COVID-19 has affected millions of people over the past year and a half. One thing that is quite clear is that the virus attacks the lungs of the infected, causing many to exhibit symptoms of severe pneumonia and, in turn, low blood oxygen levels. Besides professional medical equipment seen in hospitals used to measure oxygen saturation, in recent months, pulse oximeter and smart watches with oxygen saturation tracking functions have become a way for many people to monitor their own health. A medical expert says, however, that the pulse oximeters can only show if oxygen saturation is low and are not the best way to determine COVID-19 symptoms.
The pulse oximeter is not the best way to tell about the COVID-19 situations. It's only good to detect is anybody having low oxygen in the blood. As of, they can show low oxygen saturation, or medically we call hypooxygenation, low oxygen concentration, something like that. If someone have COVID-19, but the disease hasn't affected the lung so much, the patient may not have low oxygen saturation. His oxygen level could be into the normal range. But when the lungs start getting more and more damage, then oxygen start getting lower. That means if anybody have low oxygenation, usually the disease process is quite advanced.
Although there are some similarities between a pulse oximeter and a smartwatch with an oxygen saturation tracker, you cannot rely on its measurement as there are many factors involved.
Pulse oximeter medical grade is designed for checking at the tip of fingers with high accuracies. But for the arm watch with oxygen saturation, its main has not been tested for many circumstances, which in some circumstances may not be used to replace standard pulse oximeters. If the patient have poor circulation, have partial obstruction of the blood vessel, or have low blood pressure, pulse oximetry could be inaccurate.
Normally, oxygen levels should be above 96% and can vary related to the oxygen source, lung condition, and circulation. Someone could have 99% or 100% saturation. Dr. Surasit said that people with chronic diseases such as obstructive pneumonia, obstructive pulmonary disease, chronic obstructive pulmonary disease or COPD, or other chronic lung diseases could have a baseline lower than usual, around 93% to 95%. So, the best way to check if you are infected with COVID-19 is still an RT-PCR swab test. But if your home oxygen saturation reading is lower than 95%, call your healthcare provider. Reported by Kittipat Sukhjit for Thai PBS World.